The background of the study is chemotherapy-induced peripheral neuropathy is a burning issue, an important issue in the world and also in our country. And the exact extent of the chemotherapy-induced peripheral neuropathy and its impact on quality of life is not known here. And in this study, we want to evaluate the extent of CAPN and their impact on quality of life in breast cancer patients receiving chemotherapy. Our aim of the study is to improve the knowledge about the quality of life of breast cancer patients during the chemotherapy treatment session and to correlate the CAPN with quality of life and to provide the real picture of CAPN which represents as a tip of the iceberg to help the future planning and treatment. Methods: this is a retrospective observational study evaluating the patient of breast cancer attending the oncology department of Kurmitology Eye Hospital from 2019 to 2023, and non-metastatic breast cancer who have completed the treatment been included in the study, and quality of life is determined by European Organization for Research and Treatment of Cancer, QLC C30, and CAPN is EORTC CAPN 20 Bangla questionnaires. And the study I have mentioned earlier that metastatic breast cancer been included and completed the patient who have completed the treatment of breast cancer with chemotherapy, and clinical features suggestive of neuropathy been included. And exclusion criteria includes metastatic disease and patient who are unwilling to take part in the study. These are some demographics details of the study. 37 patients been included, age ranging from 24 to 64, and the median age is 48 years. 36 of them are female and one are male, one is male. And within the female patients, 24 are premenopausal, 12 are postmenopausal. And these are the educational status showing most of the patients are in the primary education group, completed primary education in 24 of the patients, and rest are shown in the picture. And these are the stages of the patient we have been including, and it has shown that stage 2A disease contained 14 of the patient and 2B 10 of the patients, and rest are the showing here. And these are the IFC status of the patient. It has shown that 24 of our study population has ER positive, rest of are ER negative. 21 of them are PR positive and rest are PR negative, and 5 of them are HER2 positive and rest are HER2 negative. And this demographic data shows the tumor size and nodal status of the population. Most of the tumor are T2 size, 25 of them, and T1 is 6, and followed by T3, T4, and T0, 3, 2, and 1 respectively. And most of the nodal status are N0, followed by N1, 15 in number, and N2, N3, 1 and 2 respectively. These are the different treatment options being treated. Most of the patients did not receive neoadjuvant chemotherapy. As we have shown, 7 of the patients been treated with neoadjuvant, rest 30 is adjuvant treatment, and 26 of the patients been treated with radiotherapy, and 11 not treated with radiotherapy, and 36 of the patients been treated with surgery. And considering the chemotherapy cycle, most of the patients, almost 35 patients, have been treated with 8 cycles of chemotherapy, and one patient each been treated with 4 cycles and weekly chemotherapy. And this is exercise time. Around 30 minutes exercise be done by 14 of the patients, less than 30 minutes 17 of the patient, and 6 of them did not exercise at all. These are the duration of chemotherapy, duration and CAPN, sorry. Duration of CAPN is less than 12 months in 29 of the patients, less than 24 months in 6 of them, and more than 24 months in 2 of the patients. And status of neuropathy is decreased of symptoms of CAPN in 21 of the patient and stable disease in 16 of them. And no one complained of increase of CAPN. Now the scoring of quality of life, C30 system, this has global health status by quality of life score and 5 function scales, including physical functioning, role functioning, emotional functioning, cognitive functioning, and social functioning, and symptom scales like fatigue, nausea, vomiting, pain, dyspnea, insomnia, appetite loss, constipation, diarrhea, and financial difficulties. All of the scales and single items measures ranges from 0 to 100, and high score represents higher response level, and thus a high score in the functional scale represents high quality of life, and high score in the global health status per quality of life represents a high quality of life, but a high score in the symptomatic scales represents high level of symptomatology. This is a scoring system for CAPN 20, includes 3 parameters, sensory, motor, and autonomic scale in 20 items. And this is the table 1. This is the association between clinical characteristics and global health status per quality of life. The different clinical characteristics like age, response to peripheral neuropathy, and menstrual status, chemotherapy, radiotherapy, and surgery, comorbidity like diabetes, number of chemotherapy, ERPR and HER2 status, shows there is no significant value we have found in this study. And table 2 shows the correlation between quality of life and CAPN 20 sensory scales. It has shown that it has significant change in the physical functioning, as well as there is a significant change in the social functioning. Physical functioning means the gross functional status, and social functioning represents social stance at the family and community level. Now, table 3 shows that correlation between quality of life and CAPN 20 motor scales. It has also shows that global health status per quality of life and physical functioning as well as social functioning is impaired, and some symptomatic scales like nausea, vomiting is also hampering quality of life. And the table 4 shows that correlation between quality of life and CAPN 20 in autonomic scale, and also in this scale it has shows that physical functioning and emotional functioning is also impaired as well as social functioning, and some symptomatic scales like pain and fatigue are impairing the quality of life in autonomic scale. In our study, we have found that there is significant relation between functional, emotional, and social functions of quality of life with chemotherapy-induced peripheral neuropathy, and symptoms like nausea, vomiting, dyspnea, and pain have a significant impact on quality of life. In conclusion, the effect of chemotherapy-induced peripheral neuropathy on quality of life is significant, but the exact extent of the impact is difficult to assess from a single center study containing this small group of population. Thank you.